that basic idea was established virtually a generation ago, but it still hasn't quite sunk in some of the policy commentary. Now, here's an example of how you do that. And I think this one's really quite interesting, or at least it certainly will be if this thing ever... It says next slide. There we go. Okay, real world, all right? Many of you will be familiar with this, particularly if your pension plan holds Shoppers Drug Mart stock. What happened here? Well, what happened here is pretty obvious. The Government of Ontario said that in future we will reimburse generic drugs under our plan. We will reimburse them at a rate 25% of the cost of the corresponding brand name drug rather than, as at present, 50%. That's what happened to Shoppers Drug Mart stock overnight. Okay? Went to bed at night, it was trading around $43 to $44. Woke up in the morning, and it's trading $38 to $39. The market, the stock market, the analysts in it, took one look at that and said, right, that's our estimate of how much Shoppers Drug's profits will be cut. Okay? The current, it's down now as of when I looked at it when I was making this slide up. You can see it's down about 34.55, and sort of back of the envelope look at the capitalization, it's down about $2 billion. Okay, that means that according to Bay Street, Shoppers Drug Mart is now worth $2 billion less than it was before that policy was announced. Well, what's that got to do with anything? Well, what that has got to do with is that is the market's estimate of the present value. You don't know what, some of you may be familiar with present value calculations. It's sort of the current value of the impact of the loss of profit, loss of revenue that will be suffered by Shoppers Drug Mart as a result of this policy. A lot is going to depend on whether the policy rolls out across the country beyond Ontario. A lot is going to depend on whether in the end it does apply to private insurers and to people buying their own drugs out of pocket. That will affect how much the impact will be. But the important thing is that there is going to be a big impact on the total costs of drugs. Okay? And it's going to happen through a reduction in price. It's not going to happen because there will be fewer scripts filled. That's not going to happen. Shoppers Drug huffed and puffed a lot about cutting services, and Loblaws kind of undermined them by coming in and saying, well, we were planning to expand our dispensing services actually. Oh, yeah, well, so go ahead, you cut yours if you want. The point is that this is a real reduction in health costs to the public sector and maybe to the private as well if they get off their duff, which will take place through a reduction in prices. Now, again, there are obviously losers here. Shareholders in Shoppers Drug are the first round of losers, no question about it. But so the first law holds. The cost reduction has a corresponding income reduction, or in this case, wealth reduction. If it comes to much the same thing, there are economic losers, and we know Bay Street is telling us who they think they are. But it immediately undermines some of the flaming rhetoric about we are going to have to either find new sources of revenue for this system or we are going to have to dramatically cut benefits. No, you could try cutting prices. That might be a good place to start. That seems to work right here, okay? And it doesn't seem as if it's going to do anybody any harm except the shareholders of Shoppers Drug. And yeah, somebody's got to lose, no question about it. But the notion that it is simple, this is the take-home message, the notion that there is no way of containing healthcare costs which will not involve slashing services and risk to the health of the public is simply not accurate. That this is a demonstration right there that claims that were being made to that effect were being undermined in the real world almost from the moment that they were being made. Now, this is not by any means the whole of the answer. And further reductions, if costs are being contained, further reductions in somebody's incomes will have to take place. Well, I can suggest some candidates. You will find in the January CMAJ an interesting article by a group from the Canadian Medical Association Journal from a group at ICES, the Institute for the Clinical Evaluation of Services in Toronto, showing that the the rate of ultrasound in pregnancies of healthy women, uncomplicated pregnancies, has gone up 50% in the last 10 years. Okay? There's no reason for that. There's no reason to pay for it. It's not in itself the whole story, not even close to it, but it is illustrative of what has been going on in the diagnostic sector, both laboratory testing and diagnostic imaging of various types. It's been going up very rapidly. Is there any evidence of benefit from that? There is not. So could something be done about that? Yes, one might think so. One might very well think so, that would be the first place to start. More generally, I keep coming back to some of the things in the TD report. The TD report says, gee, we ought to be trying to get physicians off fee-for-service, because that tends to lead to physicians doing a lot more work and generating a lot more cost. In fact, we've been studying that pretty closely in BC, and they're similarly experienced in the rest of Canada. One of the things that's been going on in physician services is that the costs, the payments to physicians per capita in constant dollars, inflation adjusted, have been rising quite rapidly in the last 10 years. Well, that's interesting because physicians report to the Canadian Medical Association, self-report surveys, that their hours of work are actually going down. So when you look at that, you say, well, that's funny. Everybody knows there's a shortage of doctors. The doctor-to-population ratio hasn't changed in 10 years. So why is there a shortage? Well, they all say they're working fewer hours. Yeah, all right, that could cause a shortage, and the population is aging, slowly, but it is aging. That could be a shortage. But they're getting paid for a whole lot more something. Well, we don't know what they're getting paid for because we have been moving away from fee-for-service. And the TD people obviously didn't notice that, but there's been a major change, about 20% shift in the proportion of fee-for-service payments has gone down, and the proportion of other alternative payment programs has gone up. And we don't know what those alternative payment programs are buying. Canadian Institute for Health Information is very interested in trying to figure out how to get a handle on that. The Auditor General in BC said, nearly 10 years ago, we ought to know more about this. So the payments are going up. Measured services are not. Maybe something could be done about that. Maybe we could actually have a look and see what those payments are going for. That might be a good place to start. Now, I said I would present a bit of data, but I do really want to make sure that the take-home message here is clear, that claims that you cannot contain costs without slashing services are simply falsified by the experience of the first week of this April, and they will be falsified further, and there are lots of other places we can look for addressing the question of can we do things smarter, and the answer is yes. Now,